Hey, Casibang's crew, welcome back. So we are in personality. We are doing video number 6, and we're going to talk about the Neo-Freudians, and we're going to finish up the psychoanalytic approach. So first of all, criticisms about Freud's psychoanalytical approach, and I'm sure some of these criticisms you are well aware of already. We've already talked about he's a little bit weird. He focuses on aggression and sex too much. But some of the criticisms from a psychological perspective. So the first one, Freud did not do any experiments to develop his theories on personality. No experimentation whatsoever. Okay, he based all of his ideas on his patients, okay, his case studies. And most of his patients were women. Okay, so all of these theories were based on women and his own ideas of why they were exhibiting some of these mental illnesses or some of these adverse personality traits. He decided how accurate their childhood memories were and included only those that he thought fit into his theory. So it's very, very, very subjective. Okay, no empirical evidence whatsoever. The second criticism is that he used free association and dream interpretation as a way of collecting information. And we know that that is not accurate. Okay, again, very, very subjective, very vague in a lot of senses. And again, he would fit the patient's words to mean what he thought they meant or what he wanted them to mean or what worked best with his theories. Okay, so too objective. All right, so after Freud, we have a category of psychoanalysts called the Neo-Freudians. Okay, so the Neo-Freudians were followers of Freud, but they sort of broke off into their own path a little bit. They developed their own competing theories of psychoanalysis. So they placed a little bit more emphasis on our conscious mind and kind of did away with the sex and aggression motivations that Freud used for everything. There are a couple important Neo-Freudians that you need to know about. Okay, we already talked about Erickson. We talked about him in the development unit. He did the psychosocial stages of development. So Erickson developed his theory based on social rather than sexual relationships, okay, covering the entire lifespan. But Erickson was a Neo-Freudian. Alfred Adler, he proposed that feelings of inferiority were the driving force behind our personality, and he developed the birth order theory that we're going to talk about in class tomorrow. Karen Hornai, everyone get a little giggle out about her name. Okay, Karen Hornai, obviously a female psychoanalyst. She developed a theory based on basic anxiety, okay, that we're all born with a basic anxiety, and really rejected this concept of penis envy, which I didn't even talk about. Hopefully I talk about it in class. I'll have to write myself a note. But she said that basic anxiety was anxiety that was created when a child is born into this big world. Everyone is so much bigger and the world is so much bigger than they're used to in the womb. And that bigness and that sense of extreme power from that big world leads to this sense of basic anxiety that she felt like everyone was born with. She also really discredited Freud's theories as being anti-woman because a lot of his theories were very negative toward women. When you look at like the Electra complex and you look at the concept of penis envy, it was all that, you know, women were always striving to be men. So she obviously as a woman and as a woman psychoanalyst really tried to steer away from that male dominated view. And the last one, and probably the most prominent one, was Carl Jung. He developed a theory of collective unconscious. So he separated these ideas of unconscious a little bit further than Freud did. So he said we all had a personal unconscious. So this is the unconscious mind that was described by Freud. Things that we have in our mind that are down there deep and we have to work at getting out of. And then he said that we had a collective unconscious. So these are memories that are shared by all members of the human species, from caveman days up to current, no matter if you lived in Asia or Africa or the United States, no matter what race, ethnicity, we all, Jung believed that we all shared a collective unconscious, or memories of evolutionarily memories, basically, of our lives. He also believed that we had archetypes. So these are universal human memories. So one of the archetypes that he talked about is this idea of mom or mother as the caregiver. So even all the way back to caveman times and back through history, we've always seen mom as the caregiver, the creator of the family, the life of the family. And Jung would say that that is an archetype. That is one of our collective unconscious memories that are shared by every human being. So the last thing we need to talk about is how the psychoanalysts assess the unconscious. Okay, since Freud was all about the unconscious and having to get to that information in the unconscious, how did he do that? So there were several different things that they used to assess the unconscious. One was free association. So this is a method of exploring the unconscious, and it is the traditional, like if you look at this cartoon, okay, the traditional, you're going to lay on a couch and you're just going to let loose with whatever thoughts come into your mind. So you relax and you say whatever come to mind, no matter how trivial, how embarrassing, no matter how much you have to say. That's the free association. Sometimes they would use like sentence starters, like I'm angry with my mom because, and then they would just have you answer the question. Sometimes they would do dream analysis. Okay, just lay down and tell me what you dreamt about last night. Right, and they would, your therapist, your psychoanalyst would write all of this information down and then interpret it based on what they thought was going on. The other way that they assessed the unconscious were through projective tests. So projective tests were a personality test, such as the Rorschach test, which we're going to talk about in a second, that provide ambiguous stimuli designed to trigger projection of one's inner self. Okay, so you're looking at a picture or you're looking at an image and you're supposed to talk about what you think is happening in that image. And based on what you say, again, your psychoanalyst would interpret the things that you have to say and make judgments based on that. So the first type of projective test is the thematic apperception test, or the TAT. So this projective test express their inner feelings and interests through stories that they make up about ambiguous scenes. So your psychoanalyst would just show you a picture, and then you would make up a story about what you think is happening in that picture. And we're going to do this in class tomorrow. The second type of projective test that we talk about is the Rorschach Inkblot test. And again, we'll play with these a little bit in class tomorrow. But this is the most widely known and used projective test. So it is a set of 10 ink blots that are designed by Hermann Rorschach. And you look at the ink blot, and again, you tell your therapist what you see within the ink blot. And it's supposed to be your inner feelings. And your psychoanalyst, again, is going to interpret what you see or what you say based off of that ink blot. So again, these projective tests are really subjective. You could ask 5 different psychoanalytical therapists what this person is saying, and they would probably have 5 different opinions. So again, it is not scientific at all. It is extremely subjective information. All right, so that is it for the Neo-Freudians. Don't forget to bring your questions to class tomorrow, and I'll see you tomorrow. Bye.